Okay, I'm just going to jump in real quick before we get started with Dr. Reardon. Just basic how we ran this last week was just try to stay muted so we don't get any background noise. If you have a question, you can type it in the chat box if you want to, and then either or raise your hand. I think I should be able to see raising hands, but then usually I'll just call on you and say, hey, I see Tim, I see that you have a question. Go ahead and ask it. And then you can unmute and ask your question. So then you can ask in a little bit more detail than what you can type. And don't hesitate to ask specific questions that might be really relevant to you in your sports. But all questions would be really appreciated. So I'm going to go ahead and hand it over to Claudia. All you.
Thank you. Okay, so I'm going to try to share some slides here. All right, Alicia, do you know how I can find my PowerPoint file to share? Let's see. I think, okay. Figure this out here. There we go. Should work. All right, can people see my slides? Alicia, can you see my slides at all? I cannot hear you, Alicia. Can you see my slides at all?
Yeah, so I can see it, and it looks like some of the people are responding in the chat that they can see it.
Yes, okay, so you can hear me and see the slides. Very good. Okay, well, thank you so much for the kind invitation to join you today. You know, maybe this topic of mental health is forefront of your mind, or maybe it's, you know, way down on the bottom given you've got other fish to fry. But my name is Claudia Reardon. I'm the consulting sports psychiatrist for Badger Athletics here on the UW-Madison campus. So my clinic is at University Health Services, where I see, you know, any of the 800 plus UW student athletes who have significant mental health concerns. I get referrals from the coaches, the team physicians, the athletic trainers on a kind of daily basis. I am on the WIAA Sports Medicine Advisory Committee as well. I'm the psychiatrist on that committee, though certainly I'm not here speaking for the WIAA. So the specific ask of me was to cover the general topic of mental health in high school athletes, and then as well to talk about some of the context as it applies to the current COVID-19 pandemic. So hopefully sharing some information that is relevant to, you know, today in this definite, you know, distinct timeline, but also, you know, for months and years to come. So with that, and I always start these kind of talks generally wanting to emphasize that while what I'm going to talk about is some of the negatives when it comes to mental health and athletes in sport, for sure, you know, I view the bulk of the impact of high school sport as very positive. Otherwise, I wouldn't be in this business of working with athletes, right? I, you know, encourage sport, exercise. So high school sports often so very good for mental, cognitive, and physical functioning. We know that high school sports are associated with higher academic accomplishment. You all as coaches help with the development of confidence, competence, character, caring, connectedness, and friendships among your athletes. And interestingly and compellingly, we know that there are actually lower rates of depression for youth who participate, particularly in team sports or a combination of team and individual sports. So those seem quite highly protective. A couple exceptions there. So there is a bit more of a risk for depression if our youth are spending more than 17 hours per week in sports involvement. And then interestingly, that raises the question about, you know, what about individual sports? So team sports seems, you know, uniquely protective there. So, and just to emphasize, individual sports still have lots of benefits. It's just that there doesn't seem to be any relative protection against depression compared to athletes in those individual sports. My interpretation of that is it's not that the individual sports are causing any harm, but rather there's something about the kids who maybe are drawn to individual versus team sports. They may be a bit more anxious, a little bit more internalizing, hard on themselves, in a way that just leads to a bit more risk for depression and probably anxiety too. So that said, and part of what we're talking about here today is the fact that mental illness, in fact, does exist in our athletes, as you're probably all painfully aware from some of the things that you've seen. And, one of the problems that arises here is that mental illness in athletes may be and often is, according to the research, under-recognized compared to non-athletes. So athletes are not getting identified as mentally ill and thus not getting treated as early as some of their non-athlete peers. So what are the reasons for that? One, it's hard to know the fine line sometimes between adaptive sports behavior and mental illness, right? So you take, a cross-country runner who's quite meticulous in attention to her diet, maybe seemingly obsessive with workouts, and what is that fine line between an eating disorder versus, behavioral habits that are actually conducive to success in sport. Secondly, athletes may be afraid of not being allowed to play if they tell someone, including their coaches, about their symptoms. Concussion is an obvious example of that, but eating disorders, that's a common thing. You're not going to let me run, you're not going to let me practice if you think I've got an eating disorder. Substance use problems as well. Third, athletes tend to deny signs of weakness, and it makes intuitive sense how that happen. So athletes, of course, experience this culture of toughness where on the playing field, you obviously can't show any signs of weakness to your opponent. And, to be able to psychologically turn that off when you step off the field and to say to yourself and to others, something's not right. I am not feeling good here. I am not feeling well, can be a difficult transition to make. And then finally, like it or not, and I'll be the first to admit, there can be this tendency of healthcare providers and others, including coaches, to idealize talented athletes in a way that blinds us to the possibility that they could be suffering. So, I see athletes all day, every day in my office. And I admit, if I go to the waiting room and I get the 7-foot tall basketball player or the, 300-pound star lineman on the football team, the initial reaction is not one of, they could be depressed or anxious. So we have to call ourselves on that possibility. And then what about COVID-19? So athletes at risk for mental illness, for sure, at baseline, and COVID-19 is worsening this risk for athletes and for everyone. And how is that happening? So anxiety and depression are two sort of big categories of mental health symptoms to talk about. Anxiety is worse for a lot of people, perhaps for a number of you. There's fears related to the virus itself, but also to the impact of the virus and schools being shut down, about school and how does this impact my ability to, get into college if I can't take the ACT and demonstrate, in fact, I, am smart, even though my grades may not show it, or sport, and people who were really aiming, to get into college on scholarship through sport or other factors related to sport. OCD, obsessive compulsive disorder, something that probably a number of you have heard of, is particularly being reported to understandably be worse for a lot of our students and athletes. And it's actually been described in athletes just in the last several weeks, a number of cases where particularly this variant of OCD, where people have this significant fear of germs or contamination, quite obviously can get worse in a situation like this. And just case reports of athletes just, washing their hands until they're bleeding and just raw and open that way. Depression is also reportedly getting quite a bit worse, and I'm seeing this in a lot of my student athletes for a number of reasons as well. So, having a good social support system is protective against a low mood, but, in this time we've got this physical disbanding of our support structures, including of our friends, our non-household family, and our coaches and other members of the athlete entourage who are so powerfully important in so many of our kids' lives. As well, while you're writing workouts for your athletes and trying to encourage them to stay active, it's just not possible or not being done by a number of them, as you're aware. And so, you think about it, I can't imagine a worse public health experiment than to have big groups of the population suddenly stop being physically active. And that's what we're seeing with the loss of gym class for our students, with the loss of organized sport, with the loss, in my case, on the college campus of my student athletes, walking to class and back like several miles a day. Suddenly, a lot of that physical activity is gone by the wayside, and exercise is an incredibly powerful antidepressant. So if for no other reason, a sudden decrease in exercise is going to mean more risk for depression. And the loss of daily structure is big. Humans thrive on structure. Suddenly there's not so much structure in a lot of people's lives. I'd be remiss if I didn't mention that this impact can be quite a bit greater for minorities in at least a couple of different ways. So there's, this unfortunate increased stigma and xenophobia within the Asian communities who are being blamed for this situation, obviously completely inappropriately. And fear of wearing masks in public within Black communities, with the sense that this is, going to worsen the racial profiling and stereotyping that. So, and I've seen that, sure, something for us all of. So, what about general risk factors for mental illness among all high school students, not just athletes? And again, stepping back from the COVID-19 pandemic, because I want there to be some pearls here to take away, as applied for, the foreseeable future. So you can think about, on your teams, who are those athletes who might be at risk for depression, anxiety, et cetera, based on these sorts of factors that you may or may not be aware of exist in their lives. So if there's a family history of mental illness, if they've been involved with the juvenile justice system, if they have chronic medical illnesses of any kind, if they use substances, far more likely to have mental health problems, identity issues. So for example, for our LGBTQ identified athletes, the risk of depression and suicide is far greater than for other athletes, just given the stigma and marginalization, of course, that they unfortunately experience. If there's family dysfunction or chaos at home, trauma at home or other places, and poverty. And as you may be seeing or be aware of, the issues there highlighted are ones that for sure are, being exacerbated by the pandemic for some of our student athletes. So, really sad reports about rates of child abuse in the home being increased, and that's even with the fact that, teachers and coaches, who are often some of those most likely to report suspicion of child abuse, are now not necessarily in a position to be doing as much reporting. And despite that, there's, more of these reports about abuse in the home. Poverty, of course, certainly an increased concern with people losing jobs. So what about other stressors, in this era of COVID-19 that our athletes are experiencing that are just going to sort of pile on sort of the mental health problems they may be experiencing? And a lot of these are really disproportionately being suffered by our lower income families. So parents who still need to leave home for work. So youth at home have all sorts of unsupervised time. Our high school youth may need to be providing childcare for younger sibs, all while they're trying to do their virtual schoolwork, and by the way, fit in sports practice too. Variability in access to internet connections or computers just when they're needed most. Lower income families less able to appropriately socially distance for a number of reasons. And, with regards to the workouts we want our athletes to be doing, just less likely to have access to home exercise equipment or space. So of course they need to be quite creative about that, as you know. So let's talk then. So we talked general risk factors. What about sport-specific risk factors, even in not a pandemic time? Like, what are the sorts of things that our athletes uniquely encounter compared to non-athlete high school students that, according to the research, does seem to set them up to be more at risk for suffering mental health problems? So lack of balance, leading to little time for sport, school, friends, family, and by the way, sleep. Sleep seems to be sort of like the last thing our athletes fit in to their lives. If you look at the research on the amount of sleep that high school and collegiate athletes get, for example, football players, it's the worst for them during season. It's 5-something hours per night on average. So not great, not good for one's mental well-being. Pressure of competition, maladaptive perfectionism, it's such a fine line, right? What's helpful there versus what becomes anxiety provoking. Declines in performance. So, our talented athletes who are suddenly slumping or choking really are at risk for more mental health problems during that acute time. For those kids who have a lot of pressure to obtain a scholarship, especially if their family couldn't otherwise afford college, that's a risk for mental health problems. Times of injuries are great risks for development of mental health concerns. Harassment, abuse, hazing by members of the athlete entourage and teammates. Obviously here in Madison, we're quite blessed with an awesome, athlete entourage, including coaches, all of you. That's not the case everywhere. And statistically speaking, on average, this does happen in our own backyard too. And then sports professionalization, early subspecialization, but the professionalization in particular at early ages, which I just wanted to touch on a little bit because it relates somewhat to a topic that Alicia had asked me to address. So sports professionalization. So more high school athletes, as you know, and appropriately or not, we could have a whole discussion about this, are specializing in only one sport and playing it beyond a single season. So, that means they get quite good at this sport. But it does mean that they're at risk for certain things. So a couple of the obvious drivers of this, for better or worse, again, private clubs and teams, which obviously need income year-round to stay in business, are urging devotion to one sport. I can say as the parent of a 3 and a 6-year-old, I feel pressure to have my 3-year-old subspecializing in a sport at this age. It's kind of nuts. And intensive parenting has become more common, with this, with parents being sold on the idea of endless practice is the route to athletic mastery. And if your kid, isn't doing that, they're going to miss out on every life opportunity possible. And I say all this hopefully without, meeting too many eye rolls, because certainly I'm, not one to poo-poo really, strong devotion to sport and practice. I come from a family that, very much values that. My brother was an Olympic gold medalist in track and field, by the way, if that gives me any cred. But I think there are risks that come with this. And so, how does this end up being a risk factor for mental illness? So the long practices and multiple daily workouts mean there is less time for other things that sort of lead to a more well-balanced identity. And what that means then is that if the student needs a temporary or a permanent break from sport, suddenly this whole thing that was their identity is gone. And, so where they solely obtain their sense of self-worth is gone. And so many of the kids in this situation are quite aware of all the time and money and energy and resources that their families put into them in that sport and the hope that they had for them. And so there's this really just great sense of failure in that situation if they're just injured in a career-ending kind of way. And the final bullet point here is, and getting to Alicia's ask of me, is it might seem that the COVID-19 pandemic means that this issue is less relevant, at the time that sports are, not able to be fully undertaken in the regular kind of way. But for some families, ironically, the pandemic has actually exacerbated parental hyper involvement. So this leads to this phenomenon of too many cooks in the kitchen. You're trying to do your coaching job. You're the, the skilled, wise, and experienced ones in that regard. But the patient perspective here, again, this sense of the more pitches you throw, the better, right? The more miles you run, the better. Even if endurance training isn't even relevant to your kid's sport, the more miles I have them running while they're home doing nothing else anyways, the better, right? Um, we know that that's not true. And there's you're probably having these things marketed to you. I don't know, but there's all sorts of now readily available free virtual training programs, especially from various professional sports leagues, or free month-long trials, or free, trials during the time of stay-at-home orders. And kids are using them a lot, and parents are encouraging their use a lot. And the sense of I might as well use it as much as I possibly can, right? Versus the coach perspective, where of course you don't need me to tell you this developmental approach, periodization, mixture of sport specific training versus general conditioning, recognition that youth and parents don't necessarily know when to stop, and none of those apps tell you when to stop. Of course they don't. So, there's, a problematic sort of clashing of perspectives sometimes, I think, that does seem to be exacerbated during this pandemic. And so, some of the general recommendations that are being given in terms of when coaching advice is seemingly contradicting with parental advice is, number one, assume that parents mean well, right? I think in the vast majority of cases, they're not intentionally trying to sabotage the coach or sabotage their own kids or lead their own kids to have overuse injuries, et cetera. So to start from that vantage point, I think will get you buy-in and goodwill. Let parents know that their involvement is welcome. You may cringe at that, but giving them that validation up front is helpful. And then providing very clear expectations for individual training. That's hard, I realize, because kids are in such different circumstances that it would be tempting to want to provide a range of what workouts might look like. But for a given kid, to be very clear about what they should be doing and following up regularly with feedback on what your kids are doing, if you can, including parents on those emails. Some parents will do better having some sort of rationale. I understand you shouldn't have to do that, but some sort of rationale as to why you're recommending what you're doing. And then, of course, reminding parents that praise and encouragement and not criticism are most motivating for youth in sports, because this pandemic is a situation where I think, parents can err on the side of overly critical. Everyone's sort of tempers are a little bit short, and that's not the context in which our youth thrive in sport or school or life. So with that, let's talk about some big picture principles here again. The scope of the problem of mental health in adolescents. So general adolescent population data. You can see in that graph, the bluish graph there on the side, that many mental illnesses have their onset just at the ages that you're seeing them during the high school years. So mood disorders like depression, anxiety, this is starting right when you're seeing them. So this huge study of US adolescents showed that a full 1/3 meet criteria for anxiety disorders, 1/5 meet criteria for primarily ADHD. That's a lot. 15% meet criteria for a mood disorder. Typically that means depression, and then a bit over 1/10 meet criteria for a substance use disorder. So if it feels like you're seeing a lot of this, it's because you certainly are. I just want to drive home some points about suicide, and specifically bringing this home to Wisconsin specific data. Talk about pandemics or epidemics. Suicide is one. If you haven't, seen this in the media, the rates of suicide in the general population in the United States, certainly in Wisconsin, and in adolescents, definitely in particular, have just skyrocketed in the last decade. No one has a full grasp on this, but it is highly concerning. It's just devastating, really. So over 16% of high school students in Wisconsin have seriously considered suicide in the past 12 months. If you let that sink in, I mean, it's really, really sad. Among Wisconsin high school students, females of color report the highest suicide attempt rates, which may not necessarily be obvious. We know that males across the board and across all ages complete suicide at higher rates than females, but in terms of attempts, which can, cause, lifelong problems in terms of medical complications. It's females of color with the highest rates. Life experiences surely impact suicide risk among Wisconsin youth. So again, the LGBTQ population at really high risk here. And other psychosocial stressors, homelessness is one that's emphasized here, are definite risks too. So let's hone in then on some specific mental health problems, just so we have an understanding of what these things look like. In other words, then what you can have, your eyes out for. So starting with anxiety, because anxiety is the most common mental health symptom and disorder in all ages, and definitely in high school students too. So common signs and symptoms: feeling apprehensive, feeling powerless, the sense of impending doom, and a lot of physical symptoms. And this is what your athletes may complain to you about without necessarily having the words that I'm feeling anxious, but rather like my heart's beating out of my chest, breathing, I feel short of breath, sweaty or shaky, before I get to the line, before the game starts, or all the time, feeling weak or tired, all symptoms of anxiety. Depression, so common signs, symptoms: feeling sad, obviously, loss of interest in activities usually enjoyed, so usually enjoying practice, school, hanging out with friends. Now that's of no enjoyment to them. In fact, they're talking about quitting sport, maybe even. Feeling empty, hopeless, guilty, worthless, helpless. Irritable is a really common one in adolescence, that irritability. Restlessness, trouble making decisions, appetite changes, sleep changes, trouble concentrating, suicidal thoughts. And again, physical symptoms are really common in youth for both anxiety and depression. So the athlete who may be complaining about unexpected pain and the medical workup isn't showing an explanation for it, headaches, digestive problems, etc. Eating disorders. And here I actually have a few slides, just because this is a disorder set of disorders that are really disproportionately common in athletes. So depression and anxiety overall, if you take all types of sports, all genders combined, probably on average equally common in athletes and non-athletes at the high school level. Eating disorders at the high school level, far and away more common in our athletes than in our non-athletes, for a number of reasons. So, and just to remind you of the two big eating disorders, anorexia and bulimia. So anorexia is the one, this extreme thinness, this refusal to gain weight or to weigh an appropriate amount. Distorted body image in that regard. And oftentimes in our athletes, we see that as compulsive exercise as a component too, in order to stay underweight. Bulimia, on the other hand, involves times of both binging, which means eating amounts of food way more than other people, peers would eat in the same circumstance, to the point of feeling uncomfortably full and horribly guilty afterwards. And then times of purging. So that typically can include making oneself throw up, using laxatives or diuretics. And in the case of athletes, what we commonly see here is use of extra exercise to compensate for the calories that were consumed during the binge. So the athlete who, for example, binges on 1,000 calories of ice cream and then goes out and runs 10 extra miles to make up for the binge, in addition to, by the way, the workout that you recommended to them, but an extra 10 miles to make up for that. So what are the risk factors for eating disorders in athletes? Some of your athletes are going to be more at risk than others, depending on the sport that you coach, but no sport has its athletes entirely immune, and there are eating disorders in every sport. And I can tell you, I've treated eating disorders in every sport at UW, including the ones where you wouldn't suspect it. So the weight-sensitive sports, though, are at greatest risk. So things like wrestling, certainly a big, I treat a lot of wrestlers. You also see in gravitational sports, in which lower body weight may be advantageous, distance running, swimming for sure. If you have team weigh-ins, and I understand, of course, that's necessary sometimes for certain sports, wrestling, of course, but that's a risk factor. Sport-specific training before the body is fully mature is an interesting one. So if an athlete was, really pigeonholed into a sport by parents or whoever when they were really young, before their body was fully mature, say gymnastics, who knows, pick your sport. And then they go through puberty, and lo and behold, their natural adult like body type is actually not conducive to, high level success in that sport. But they, all this time, money, and resources have been put into them being successful in that sport. In order to maintain the body type conducive to success in that sport, they basically need to develop an eating disorder. So that's how that can become a problem. Performance pressure, whether that's to get a scholarship or whatever it is, and then injury. So injury is a big risk time for development of eating disorders, and how that tends to play out, and quite honestly, what I hear in my office every day from injured athletes, especially female identified, but not exclusively, is this sense of, when I was actively involved in sport before I was injured, I could eat whatever I wanted. In fact, I had to eat whatever I wanted. I had a hollow leg. I had to eat 4,000 calories a day or more. Now that I'm injured, I don't know. I've never actually had to monitor what I eat. I've never even felt full before. So there's this erring on the side of really underdoing it in terms of how much you eat, just to make sure you don't gain weight when you suddenly are, this first time ever, like, I can't just eat 5,000 calories a day. So moving on from eating disorders then to talk a bit about substance use in athletes, obviously a big concern. As I said earlier, if our athletes are using substances, they're at much higher risk for other mental health symptoms like depression and anxiety. So, and interestingly, I emphasized earlier how team sports are more protective against depression. Here's where the team sports are not as protective, and that is when it comes to substance use. So high school athletes in team sports in particular are at higher risk than non-athletes for use of certain substances, not all, and in fact not most, but for use of certain substances. For the male identified athletes, it's smokeless tobacco, alcohol, both in terms of general consumption, a drink here or there, and actual binge drinking, and also steroids. For our female identified athletes, smokeless tobacco and diet pills. That leaves most of substances are being used at lower rates by our athletes than our non-athletes, but still, in particular, the alcohol for our male identified athletes is of concern. But with, that relative protection against use of a lot of substances, that is why, you hear a lot of parents signing up their kids for sports in the first place, to keep them, from being hanging out with the bad crowd and getting into substances. So one substance to emphasize, though, of growing concern for sure is e-cigarettes, vaping. For example, the brand name Juul, which comes in all sorts of amazing flavors that kids love, and they're clearly marketed to kids, is a growing concern. And I can't tell you how many UW athletes I have who do vape and use a Juul, and they started in high school, early in high school, surprisingly early in high school, and they have a shocking zero understanding and realization that there are any health consequences to vaping whatsoever. There are health consequences to vaping. It is not great for sports performance, but they don't realize it. They just see it as this entirely safe alternative to traditional cigarettes. It's not. So strategies then. Let's talk a bit about strategies. So generally, when we're talking about mental health in athletes at any level, and certainly at the high school level as well, a team approach is recommended. So you are a major, I should say, the major part of that team, and you may not view yourself as a mental health provider, but you are. You're a de facto mental health provider. I mean, you see this stuff, you're oftentimes the first to even recognize that there's a problem, and maybe sometimes are involved in referring people for help. So, the team of people involved in this sort of stuff, recognition, referring for help, providing the help, coaches, the team doctors, the athletic trainers for sure. I talk to so many athletic trainers every day. School nurses, school counselors, and then if and when you need to refer out to the community for really, more intensive treatment, the community-based mental health professionals in the form of psychologists and psychiatrists, as well as registered dietitians. Definitely, if you're looking at the eating disorders, are a big part of that. So really important for all of those frontline members to have good open lines of communication. Hopefully students are okay with that, are giving us permission for these parties to be talking. And concussion is an obvious example of how and when, these parties need to be talking in terms of implementing academic accommodations, and then obviously the return to sport as well. But it really applies across the board for all mental health problems where communication is helpful. So I can't emphasize enough the importance of having a plan, hopefully a written plan. Just like a lot of institutions and districts are going to have a written plan for how do you deal with sudden cardiac arrest. Hopefully that doesn't happen very often. With concussion, there are even rehearsals of how we deal with some of these kinds of things. Similarly, schools and districts should have written multidisciplinary plans for what you do about mental health problems that arise. That should include if and when caregivers should be notified. It should include emergency mental health care planning. So in the event of threat of or actual incident of self-harm or harm to others or destruction of property, what do we do in that circumstance? Who do we call? When do we involve the caregivers? So I would like to share some specific wording in general. If you have any concern about your student athletes, what can you say to them? Because I can tell you that if people don't know what to say and they're worried that what you say might make things worse, or if you're worried about, like, what if I ask my student athlete if they're doing okay and they say no, but then what do I do then? I don't know what to do. So I'm not going to screen for something or ask about something if I don't know what to do as a next step. So then what happens is then, most people don't say or do or ask anything. And how the athlete interprets not being asked if they're okay when they're clearly, showing evidence that they're not okay is that person doesn't care. The coach doesn't care. The trainer doesn't care. They don't want to know. All they care about is the sports performance. It's so not true. I get that. Those aren't the reasons that people aren't asking. But from sitting with athletes all day and every day who are interpreting silence and not being asked as not caring, I can tell you that's how that is interpreted. So some simple things to say, and these may not roll off your tongue because you may not be used to asking them, but how are things going with you? I noticed you haven't been yourself lately. What do you think? Tell me what's going on. Tell me more about, certain incident. I'm concerned about you. How cuts get on your arm. So those sorts of statements just go so far in terms of conveying concern and positive regard for your student athlete. And quite honestly, even if you don't know what to say next, just the fact that you said that goes really far. Just be human, and it's really appreciated by our students. Other principles, ensuring safety and err on the side of safety. So, I sort of said earlier that we need to have a written plan about who and when we contact, when do we contact the patient's family and their caregivers. If you have any concern that the athlete is at imminent risk or, they could hurt themselves in the near future, you don't need written permission to contact parents, to contact 911. Err on the side of doing the right thing and protecting their life. When in doubt as well, you can expand the field in terms of collaborating with your colleagues. It is so helpful to get another opinion about what you should do. And then if you are, able to take steps to get the person to the ER in the worst case scenario for really, serious situations, or, they're able to seemingly get connected with their primary care physician, team physician, a mental health professional, do follow up and ask them to make sure that they actually are seeing that person in an ongoing sort of way and really getting the appropriate help that they need. So, and what about coaches in a general sense, having some role in contributing to an environment that actually promotes mental well-being and resilience? Because you have a big ability to do this for sure, whether or not you realize that, and you probably do. But so I think one important thing is to be aware that there are these common sports situations that on average stress mental health. So when you are in your season at the peak of the training load, your swimming practices are as tense as they're going to be. Your distance runners are running the highest mileage they're going to be all year. those are the times when anxiety and depression are most likely. There's classic, really compelling research actually out of UW-Madison decades ago that showed this. It looked at the UW-Madison swim team and looked at their profiles of mood states, their levels of depression and anxiety as the season went on, exact correlation with how much training load there was. Times of highest peak training, the most depression and anxiety were being suffered. And I emphasized it earlier as well, but injury is really a high risk time for mental health problems as well. If you have a platform to communicate the importance of mental health care to the parents of your youth, that's really helpful too. Promoting athletes' psychological flexibility and self-compassion is really just very important. And your word choices with that really matter. So if the athlete has a bad practice or a bad competition, to use words that convey that, okay, it was one bad practice, one bad competition. It doesn't mean the whole season shot, right? True, the current whole season is sort of shot in some ways. But again, to emphasize that there are still goals that we can be working toward, and to keep that positive mindset really helpful. In day-to-day training, coaches can de-emphasize achievements and instead foster a process-oriented mindset in which we really recognize effort. And, again, I can imagine some eye rolling to this, but those are recommendations that are given even at elite and professional levels, because we know that actually ultimately brings out the best in our athletes. And then finally, it really says a lot if we intentionally allocate time in the athlete's normal practice schedule to learning positive psychosocial skills versus just the physical practicing of the sport. It really says something about, valuing of the athlete's overall mental well-being, which quite honestly, ultimately is going to bring out their best sport performance anyways. So what about stuff you can do specifically during the COVID-19 pandemic, as I think a lot of you are doing, keeping in touch with your team, both collectively as a whole team and then individually, is so helpful. I've said it probably 3 times already. I'll say it a 4th time, that you're such a valuable part of their lives. For so many of these kids, you're one of a small number, if the only person in their life that they trust. When you think back to your own high school sports involvement, if you had some, and probably most of you did, and you can, it really makes you appreciate how important coaches are and were. And as much as you can, make space for them to share what's going on with them. How are things going with you? How are things with your family? Beyond sports practices, virtual sports practices, organizing virtual team meetings and hangouts is a way for teammates to connect right now can be huge, because again, we all thrive on social connectedness. Encourage players to communicate about how their workouts are going, and that can really help keep others motivated who otherwise might be lagging in terms of motivation and feeling like, what the heck is the point now? But our athletes have competitive spirits, and so that is one way to keep them interested and motivated. And there are other strategies that you can use to keep them involved and inspired. My brother is a collegiate track coach, and so I was talking to him about some of the things that he's done, and others have recommended these kinds of things too. So having the team watch inspiring sports movies, listen to inspiring podcasts from athletes, and then coming together virtually to discuss lessons learned. And then finally, just like all these pro sports leagues are offering free sort of workout apps, a lot of places like Headspace and others are offering free use of their mental skills apps. And what a great time this is to work on the mental game in terms of sport as well. And for those of you who aren't aware, if you're interested in taking advantage of this time, either for yourself to get more sort of awareness and education in mental health issues when it comes to athletes, or for maybe, your coaches or your assistants who couldn't be on this call, and also for your own athletes and also parents of athletes, there are a number of trainings through NFHS, the National Federation of High School Sports, that are available for free. So this is an awesome one. I've done it myself on student mental health and suicide prevention. And so, as I said, it's free. You just go to that website. Some state associations, though not yet WIAA, are requiring it for coaches for good reason, because it is really well done. So, and there are a number of other relevant ones too that you might consider looking at, particularly if you're running into these sorts of issues. So in conclusion, mental health problems are unfortunately common in high school students, and athletes are far from immune to them. And COVID-19 has created all sorts of new risks for our athletes in terms of developing mental health problems. But if you as sports staff understand those signs and symptoms of mental health problems, there can be opportunities for earlier intervention and treatment. And if you intervene early, the earlier the better, in terms of really changing the trajectory of the rest of their high school career, and quite honestly, the rest of their life. It really makes a difference how early mental health disorders are recognized and treated. I can't emphasize that enough. You can take steps to create this environment that promotes mental well-being and resilience, and having a well-developed plan, just like for other medical problems, will facilitate, recognizing these problems early, by the way, is protective in terms of minimizing risk for school districts too. So with that, I'm happy to take any questions by email at any time, and certainly live right now too.
Thank you. If anybody has any questions, you can go ahead and just type you have a question and I can call you out. I will say, as a parent who has 2 kids with mental health struggles, and one of them you probably saw in the newspaper, he plays hockey at the UW, having people care and reach out is really important. So he kind of got overlooked, and everybody just assumed he was a great athlete, and he didn't have any issues, and it wasn't coming out on when he was playing hockey. It was more academically and socially, and he was slipped through. And so that was a really hard struggle, and once he got help and he knew it was just where he was at, and it was something he could work through. It changed a lot, and now he's in a really good position at UW. UW has great resources, so it is really important, and it is hard as athletes. I think that stigma. And I think, looking now at my kids at high school level, how important it is to see the setup of the mental health at the high school level.
Yeah, absolutely. Well, I'm sure glad he's gotten help and treatment.
Yeah. Let's see. Michael Harris, Coach Harris, football coach. I'll read your question. Can you share any plans that the UW is planning towards the integration regarding returning to normalcy for the student athlete when we return to our schools? So what's happening at the UW?
Yeah, that's a great question. And it's so hard to plan for that because we don't know when that return to normalcy is. The talk now is, hopefully we'll have people back on campus for the fall semester in person, but that, quite honestly, that's still up in the air. So, the coaches have continued to engage with the athletes as much as they can. And, the athletes themselves are typically on the teams doing a really good job of staying connected, virtual practices and virtual social hangouts, which have been really helpful. So, in terms of other plans to return to normalcy, it's going to be a challenge. I think the coaches are aware too that everyone's going to come back sort of with differing levels of fitness because there is such variability and motivation. I just spent a full day talking to my patients via Zoom, a full day of UW student athlete patients, and you can't imagine greater variability in terms of how much they're doing with workouts, even at this high collegiate level. So that's going to be a real challenge, just to meet each athlete where they're at.
Yeah. David Olson asked, are there any particular mental health issues we should expect to be heightened when we come back together? I'm thinking particularly of students who think they may be behind with their training, or next spring when athletes who have missed a whole season.
Yeah, absolutely. I think, anxiety is a big thing. So at baseline, anxiety is the highest sort of prevalence of any mental health problem in
Can you hold up just a second? You're kind of freezing.
A lot of people, particularly conscientious, hardworking people. Oh,
Hold up just a second. Okay, try again on that.
yeah.
Sorry, you were freezing.
My prediction is anxiety is going to be the biggest thing that we see, just in terms of that, the conscientious athletes who are very worried that they're going to be behind. So yeah, I mean, I'd be aware of that, and I think it goes far just to normalize that sense and to say, like, that's a really a lot of athletes are feeling right now, because no one had ideal training circumstances and no one had the optimal, home gym weight set up in their basement to be doing this. So just normalizing that and, offering support where you can.
What about like right now? So there are probably maybe like freshmen and sophomore, or maybe even some of the seniors who are not the super elite high school athletes who maybe have not been keeping up, and this just happened. How do we keep them active? Where they're not feeling just like they're so far behind, they're just done.
Yeah. So, right. So it's that black and white thinking where it's like, well, I might as well just quit because I'm so far behind. Well, so, remind them a lot of people are in your shoes, and, you're a freshman, you have not missed the majority of your high school career, even your sophomore year. And so, a lot of people actually don't even start participation in a sport until a little bit later. So it's not like they're irrevocably done with sport. And again, choice of wording to really role model mental flexibility about that is huge. And I think they will come back with more confidence if they do anything to stay active and to stay in the routine of, maintaining some sorts of sport skills, and sense that they're making some progress in some way, right? Even though it's not ideal.
Thank you. All right, Coach Liebert has a question. Are there small steps you can recommend to build student confidence in talking about mental health? Obviously, sorry, my question just went down. Obviously, building relationships with athletes is number one, but teenagers don't know how to talk about this, and neither do many adults. And Steve, I'm sure Ty would probably talk, but yes, this is a really big issue. Yeah.
So you're getting at something called mental health literacy, the ability to even know that what you're feeling is anxiety, or what you're feeling is sadness or depression. And youth don't have that. And youth athletes have even less of it than non-youth athletes. Again, getting to the culture of mental toughness and all this stuff. So as much as you can, use those words. Don't be afraid to say the word worried or anxious or sad or depressed. Are you feeling sad? Are you feeling worried about stuff? In role model that just, it's okay to say those words. It's okay to talk about this stuff. I feel okay talking about this stuff. I'm not judging you. So the more that you can, emphasize that this is totally okay for conversation, the more that they'll feel that way too. And then if you have the opportunity to use those words with parents, then they're going to further be role modeling that that's okay. It all is helpful.
Yeah. Rhonda has a question. Any advice of what to say now to athletes right today who found out that their track season is basically over because after training on their own has been so hard?
Yeah, it stinks. Oh yeah, that's so. And the question is, should the senior track athlete stop training? My immediate reaction is no. I mean, I think there's something to be gained mentally from feeling that you stuck it out and did your entire senior season, even though you can't compete at the end of it. But just knowing you still did the workouts, you were still training, and you emerged at the end of the season, in as good a shape as you could, given the circumstances. And there's something to be gained from feeling that you did that, and feeling that, you're physically well conditioned and trained, and really did do your full 4 years and maybe beyond for some of the athletes. So yeah, it's tough though. So I mean, an important part of that too is acknowledging the loss that they're suffering, because that is a grief process, right? You put so much time and effort into that, and it's supposed to be the culmination of your year or your high school career, and it's gone, and it's suddenly gone. And you are grieving and mourning the loss of, the hope and excitement that you had for that. And that's okay. I will say a general recommendation too for anyone who's suffering a big loss or grief of any sort is somehow getting that emotion out. And so for a lot of people, and this has been really helpful for a lot of my athletes, is journaling. Even if you don't have this therapist you can go talk to in person, but just writing about how you're feeling can be quite therapeutic. And that it does seem to be a venue that works well for a lot of athletes.
Another question is, you mentioned racial disparities due to COVID-19. Are you noticing mental health issues with students in Madison due to racial differences in general, and how are these addressed?
Yeah, so among the athletes and among the non-athletes, yes, absolutely. So, statistically speaking, our African American communities are more impacted by COVID-19. So on average, my, African American student athletes are more likely to have loved ones who are quite sick with the illness. They have more medical comorbidities on average, but of course there's also, worse access to medical care and worse medical care when you do seek treatment as a minority, sadly, and for a number of reasons. And so, it's something that when I see my athletes and non-athletes alike, it's just acknowledging that and, allowing them the time and the space to process that and talk about that. So how are the racial differences addressed? I mean, so not specific to COVID-19 and I'm not sure if that's specific to COVID-19 in general or general, but I can say that the clinic on campus where I work, UAS, there's an awful lot of outreach to the whole campus. We know that minority students to seek mental health care. There's understandable and appropriate distrust of the medical system in general. And so we go to places where they are in different dorms and different settings to reach out and sort of normalize and demystify the process of getting mental health treatment, which has seemed to be helpful.
Another question, if and when high school sports do come back, will with no crowds, no fans will, no fans will be the next thing. Okay, yeah, probably no fans. Yeah, I mean, I don't really know, maybe Jeremy can answer that one. But how will they deal with, I mean, like, I suppose no crowds, how's that gonna affect the athletes, like mentally?
Yeah, I mean, it's a great question. I think athletes are differently motivated by the crowds and the cheering for them. And I think in different sports it matters too. So athletes haven't had that experience, ever not having crowds. So I don't know, some athletes it will be different, it will be harder.
All right, are there any other questions out there? Don't forget, I will, when I send this video out, I will also include her email information in case anybody has any one-on-one conversations they want to have with her. And if any of the coaches want to follow up with more mental health questions or concerns, or maybe some ways that we as a district can do a better job, I'm definitely willing to look into that and try to create something. And I'm sure I can reach out to Claudia and see where she can help direct us in a little bit too on that.
Yeah, for sure.
Okay, you're getting lots of awesomes. So
oh, thank you. You're all so kind. It was great. I really appreciate that.
All right. Well, I would like to thank you for speaking, and thanks all the coaches for attending.
Well, don't hesitate to be in touch if I can.
Okay, great.
Thank you.
Thanks.